time for some questions too.
Sure.
Right.
Okay, so we're going to get started in just a moment. My name is Jane Hoagland. I'm the Active Older Adult Coordinator at Harris. As you guys know, we're here with Effie Sperlin to talk about breast health. I'm really excited about this subject because I'm exploring getting to know more about this for the first time myself. So this is going to be a learning opportunity for me, and I hope for you guys as well. And if you get through this and oh boy, I want to share that with somebody I know, then you can also do that. This is being recorded for our YouTube page. So you'll have the opportunity to share it with others after the fact. So with no further ado, let's all welcome Effie Sperlin. Effie, so glad to have you today joining us.
Thank you. It is my pleasure. Absolutely my pleasure. Thank you, guys. It is great to see a gentleman on here. Maybe there's more than one. Thank you for joining us. Everybody, we all understand 50% of us, our population have breast tissue, and gentlemen have breast tissue also. It's just that they only have 1% chance of developing breast cancer or breast disease, where women, it's 1 in 8, which is really unheard of. It's unfortunate that 1 in 8 of us, and how many do we have on our Zoom today right now? We have what, 14, 15 people? All right, so we're looking at least 2 out of that population will or has already had breast cancer. And I'm sure we've probably got a couple people that have had breast cancer. I have a team that works with women. We work with men and women. Our practice is breast health, breast education. We also work with anything to do with the lymphatic system. I dabble in craniosacral therapy and Reiki and a whole bunch of other things, but our concentration is lymphatics for post-surgery and full body lymphatics, and then breast health, breast prevention. Our team, we have a passion at our team so that we can teach you and give you options on breast health. A lot of us don't even think about breast health until, unfortunately, we either go in for a mammogram, and we're told that a mammogram each year is a bill of health, or at least that's the impression that they give us, that if you go in and you have a clean mammogram, that you're okay. Well, I'm going to help you understand that that is not the case. Okay, we've been told that because they really don't understand that we can actually do some things that are preventative and not wait for something to show up on a mammogram. I'm going to say this over and over today. First of all, hydration is one of the most important things you can do. Hydration, everybody. We have to be drinking at least half of your body weight in ounces of water. I weigh 140 pounds. I have to have 70 plus ounces of hopefully good filtered clean water a day, so that my lymphatic system, which is the system that cleans out toxins, can actually wash out the toxins. Without drinking enough water, our whole lymphatic system does not work well at all. So we don't wash out toxins. And what's happening in our breast tissue is it takes, for most cancers, there's a couple that are very fast. So please let me make sure you understand. Everything I say is not 100% on everything. Okay, I'm going to try to make sure I make it clear. On almost all cancers, there's a couple that are very fast growing, but on almost all other cancers, it takes 8 to 10 years of dysfunction, congestion, mutation before it develops into breast cancer. I'm going to repeat that. It takes 8 to 10 years of dysfunction, heat developing, toxins developing in the breast tissue before it will develop into breast disease, where it can be seen on a mammogram or an ultrasound. So we actually know, we can tell 8 to 10 years before. We can actually do another test called a thermogram, which you're going to have another opportunity to hear more about thermograms by Gay Walden in the next, I think on the 11th, I believe. Gay's going to be doing a thermogram presentation, which is amazing. She and I do these presentations together a lot of times, but lymphatics is so important that we decided to break this up. So Gay will be doing thermograms, but on the thermogram, we can actually see this dysfunction 8 to 10 years prior to breast disease developing. So if we have a thermogram and we find out that our breast tissue is starting to get in trouble, where toxins are building, we can actually take action to break up that congestion and then broken up and get it out. So what our goal is as our team is to use preventative methods so that we don't ever even have to go to the breast disease issue. I'm sure a couple of us have already had concerns in the past, and we'll talk about some of that too. Just because we've already had a diagnosis and maybe had some treatment doesn't mean you can't do something else, do something different. There is prevention before, and then there is prevention after the fact also that we need to be doing, okay? So our team, we have a team of 4 therapists, 2 are RNs, and all 4 of us are massage therapists, and we all do the same thing. We all do breast education. So our goal is to let you know that you all actually have control over your breast health in a very, very large part. And we're here to provide you with some tools and some options to think about how you can prepare and take care of your breast tissue, okay? All right, and I want you to know that y'all can make a difference. So we're gonna go through a couple slides here. If I can get over to here, okay. All right, mammograms and ultrasounds, and I'm not gonna have this up for very long. I wanna talk to you all. Mammograms and ultrasounds are not a bill of health. I want you to understand that. Even though 1 in 8 are developing breast disease, we can find out this information, find out how unhealthy our breast tissue are like I said, 8 to 10 years prior to that actually developing into a mass where it's picked up by a mammogram and ultrasound. Okay, we get to make the decisions for our body. I don't want you to wait for the white coat person to sit out there and tell you what you need to do. I want you all to listen to what I'm saying, educate yourself, and then I want you all to make your own decisions. Don't wait for somebody to tell you what to do, okay? We have to be our own advocates and be proactive in our own health. And breast health has got to change because we cannot afford to have 1 in 8 women developing breast disease. When 1 woman develops breast disease, we're looking at a spouse, a friend, a daughter, a mother, a sister, a brother. Everybody's affected by 1 diagnosis, and the cost is outrageous and the emotional impact is ridiculous on 1 diagnosis. So if what I say today can get any 1 person to take action, then we will have an opportunity to hopefully keep 1 more person away from falling into a breast disease where they could be prevented, hopefully be prevented sooner, okay? Okay. All right. Once again, when you go for a mammogram, they send you the results. They say you're okay. They say it's clean. Okay. And then we settle down and we don't really do anything. We just wait till the next year, maybe. Some of us do. Okay. But what we need to be doing is actually taking some actions, because we can actually change our tissue structure by touching it. And I'm going to go through all that with us today, okay? What really bothers me is when you do go in for that mammogram, so many of us are called back for a recall because they see something suspicious. And then it may be 2 weeks before you get back in. And then you spend that next 2 weeks in total fear a lot of times. And that's not what we need to do. So then you go back and you have another mammogram, and then they'll probably do an ultrasound. And then if they see something suspicious, they're going to encourage you to have a needle biopsy and then possibly a lumpectomy. And the number of situations where this is not, where things have not, there wasn't anything that they found is very, very large. I'm just wanting you to think about, you actually have some decisions you can make. If you find something in your breast tissue, that's great, which means you're looking for stuff, okay? You're paying attention to what's in there. But the majority aren't even touching their breast tissue. They're not doing if they are, they may be doing a monthly check. in the shower, but the majority of the people almost never check their breast tissue, so they don't know what's in their breast tissue. If you don't know what's in there, you don't know if it changes. So if I don't know what I have today, how do I know if it changes? I don't, unless I'm paying attention to it. So I'm going to go through some of the things on what you can do to show you how to work your breast tissue. And if there's any questions as I go along, by all means, can we do that, Jane? Can they ask? Okay, good, good. Once again, a clear mammogram is not a bill of health. I know that sounds contrary to what we're told, but we can actually tell things 8 to 10 years developing before it shows up on the mammogram and an ultrasound. Okay. You have options. Okay. Just because we're told to go get a mammogram doesn't mean you have to do it. It is your body. We have the right to make our own decisions. So what a lot of our women do that come to our clinic is the going age right now is anywhere between 40 and 50 to get a mammogram. Okay, their first mammogram. All right, a mammogram is not a problem. And then to actually find out if you have dense breast tissue, which we'll talk about a little bit later, the only way to find out what your density is, which is how thick that tissue is, and that's really all it is. Density is how thick versus fattier the breast tissue is. And dense breast tissue is not a problem. It's just your tissue. So there's nothing wrong with it. But the only way to find out about the density is to have a mammogram. So a mammogram now and then, every now and then, is not a problem. I'm not here to say don't do mammograms. I'm just here to say we need to monitor how many mammograms we're actually doing, because mammography is radiation, and radiation does cause cancer. So the very thing that we're looking to prevent cancer can help cause it. Okay. All right, we need to think outside of the medical system. And after I get done talking today, you'll know that you actually have options, that there are people you can go to say, help me find out what's in my breast tissue so that I can monitor. And that's the trick. It's where you find out what's in your breast tissue and you monitor it, not a doctor. You don't wait for a doctor to tell you what's in there. You monitor it yourself, okay? And you do it daily or nightly or weekly or whatever, okay? A lot of times, and I'm sure we've all heard somebody with DCIS stage 0, ductal carcinoma in situ, which means there's 2 or 3 cells inside the duct. In situ means inside the duct. And that is actually, stage 0 is actually considered a watch and wait. It's not even considered a cancer anymore, even though they will not take that term carcinoma off of it. So ductal carcinoma in situ, stage 0, is a watch and wait. In other words, let's watch this area in your tissue. So for us, we don't want to just watch, we want to do something. And so that's sort of where we come in. We don't want to let it just happen. We want to take proactive steps. Okay. All right. Yeah, watching and waiting just doesn't work. And then the hands-on, hands-off process where we don't touch our tissue is not working. It's not working. It hasn't worked because we have 1 in 8 developing breast cancer. So we have to start changing the way we're reacting to our breast tissue. Okay, and I'm going to show you how we do that. Okay, one of the first things we can do, can you see the lady standing in front of the mirror? Okay, can we see that, Jane?
Yes, oh yeah, definitely.
Okay. Yeah, okay, good. So what we do is we suggest to our women that you actually look in the mirror and look at your breast tissue and see what's happening with it. Because if there's a change, like a rash or something comes up, we want you to know that. If a nipple starts retracting, and a nipple retraction would be where the nipple starts going in, getting pulled in, and it gets pulled in because something is growing on the inside, pulling it. So we want you to be aware if something like that happens. So we're looking at nipple retraction. We're also looking at what we call the global. If the global starts getting pulled in, there could be something pulling on the other side. So any of these things are important that we're looking for. So we're looking for nipple retraction where it's pulling in, global retraction, where one breast is much larger than the other, where you might have more swelling or more fluid up in one area. We want to pay attention to that. We want to pay attention to our shoulder heights. If I'm walking around like this, my whole left side is crunched. So I'm not breathing well and my whole area is crunched, which means my lymphatic system will not drain very well. All right, so looking at your breast tissue and knowing what you have today is really, really important. And then what we help you do is, we don't need to help you do this. All we need you to do is to actually start touching your breast tissue, understanding what's in it so that you can monitor. So if something does get firmer or more congested, you're going to know that, like, you know, that day or the next day or the next day, depending on how soon, as long as you're watching or monitoring your breast tissue regularly. Okay. Let me get back over here. All right. Here's a picture of the actual breast tissue and the lymphatic system and a vein. The blue is the vein. The little yellow pieces that look like little strings, that's the lymphatic system and all the lymph nodes that you see. And then of course the breast tissue is fat. Generally it's fatty. It's just tighter fat for dense breast tissue and looser fat for fatty tissue, okay? Dense tissue, and there's nothing wrong with dense breast tissue. There's nothing wrong. There's four designations, and I'll show you what those are in a few minutes. On this picture, you'll see where the lymph nodes go from the fatty area out to the underarm, and then from the underarm goes up, follows that vein up, and then it dumps into this clavicular chain right across here. And then it goes, then the fluid goes into the heart. So let's start back with what is the lymphatic system? Let me get over to here. Let's go to this, and we're going to come back to that other picture. All right, the lymphatic system. A lymphatic system is a system of vessels and tubules around the body that picks up excess fluid around the cells. Okay, our body, we have our heart, everybody understands that. We have arterial blood that goes down to the cells. The cells take what they need, and then we have part of the blood is returned due to the venous return. Okay, at the cellular levels, the cells take what they need, and then the cells, part of this fluid will go back as venous, as in the veins, and then some more of the fluid comes out around the cells. In that fluid around the cells are large proteins, hormones, and a variety of other toxins that our venous return cannot pick up because the capillaries are too small. So this another whole set of tubules run sort of parallel, like we looked at here, run sort of parallel with the veins, as you see there. So the fluid around the cells is picked up by another whole set of really, really small tubules. And at the cellular level, they're like hairs. They're that small. So at the cellular level, if we are dehydrated, we can't even get that fluid into the tubules. So if I'm not drinking enough water, again, there's no way to get that lymphatic fluid into those tubules. So what happens is the toxins and the hormones and the proteins that are around those cells sit there and sit and sit and sit for years because we're not moving it, because we're not drinking enough water, and we're not moving our tissue with our hands or manipulating our tissue with our hands, or we're not walking or running or bouncing or exercising, okay? If we're doing all those things, it's gonna help this lymphatic system flow. The lymphatic system does not get a kick from the heart. So the heart's pump is pushing the blood, but it does not push the lymph. The lymphatic system has no pump to it. It does have a little contracture, very, very little, but you can almost not feel it. It is a one-way directional valve. In other words, we have little valves, and the fluid, the fluid runs in one direction. It's a vacuum type system. So when my legs or my arms squeeze one of my lymphatic tubules, the tubes open, the valves open, and migrates on up towards the heart and keeps moving. So it's really the action of my muscles and movement that's actually moving this lymphatic system. Okay, in the lymphatic system, you see lymph nodes, okay? The lymph nodes, this lymphatic system is your immune system. It's the same thing. So the healthier your lymphatic system, the healthier your immune system. If your lymphatic system is sluggish, your immune system is sluggish. And we know we don't need a sluggish immune system right now. So the healthier your lymphatic system, the healthier your immune system. The more you're hydrated, the better your lymphatic system is going to function. All right. In the lymphatic system are the lymph nodes, which is where we kill pathogens and toxins. All right. What we need to do is to keep this fluid moving constantly through this lymphatic system so that those lymph nodes and all the killer cells can take care of all the pathogens that we're exposed to. And what happens with that lymphatic system or lymphatic tube fluid is it migrates up and dumps in just outside the heart into the venous return. It's mixed with the blood. It goes through the organs to get cleaned out, the liver, the gallbladder, everything cleans out the blood. It goes through the respiratory system and gets reoxygenated, and then that blood comes back down to the cells. The cells take what they need, and then the cells send part of it back via venous return, and then the rest of it is excreted around the cells. That lymphatic system then picks it up. Without the lymphatic system, a tissue will die. The tissue will die. We've all seen, unfortunately, individuals that have diabetes, and their legs are red and swollen. So what's happened is, unfortunately, their lymphatic system has become compromised, and it can't pull off the fluid, so their feet stay swollen. Okay, this is a good time to mention that. If you have an injury and you have a swelling going on somewhere, you need to have the lymphatic system moved immediately or as soon as possible. You don't want to be walking around with swollen feet and swollen legs or arms if you can help it. Because what happens is all this swelling, all this water around the cells down at the cellular level will compromise the cell wall and will compromise the lymphatic system. So please, if you have an injury, have it addressed so that we don't have a lot of swelling going on. We don't want that to continue. Okay, let me go back over here. All right, so beautiful picture of the breast tissue, muscles that are under the breast tissue, pec major. Also, what I want you to understand is on the fatty tissue of the breast, toxins love fat. That's where toxins and all the toxins that we're exposed to live. That's where they store themselves. So we're looking at insecticides, pesticides, you name it. Fumes from the cars, fumes from airplanes, everything we're exposed to. A lot of what we're exposed to are considered toxins. And toxins love fat. And so the more fat we have on our body, the more locations we have for toxins to store. So weight is really, really important for that purpose because we don't want toxins to store. So what happens is we are exposed to toxins all the time. So it goes to the fatty tissue in the breast and it sits there. And then unfortunately, and this is what I do with all my presentations, so just bear with me. We lock them up in bras and we shove them up like this, and we don't let them move because we shoved them in a bra, okay? So what happens with the breast tissue? The toxins sit here and sit here and sit here, and then eventually over those 8 to 10 years, they mutate. And that's what we don't want. So if I can take this tissue and superhydrate, move the tissue, then we can get rid of the toxins. All right, let me go over here. All right, once again, this is a sponge. All right, our body is no different than a sponge. If I had syrup, pancake syrup or something, and I spilled it on the counter and I picked up my sponge and I wiped it up, how would I clean that out? I would take it to the sink. I would turn on the water. And then I would squeeze it. And then I would turn the water on again and I would squeeze it and keep squeezing it until I got all of the syrup washed out, correct? All right, our breasts are no different. We need to superhydrate and then we need to squeeze, manipulate, do a massage that we teach our clients. It's very easy how to do it. Just manipulate. You could actually just consider your breast dough, like cooking dough, like for bread dough or something like that. Just move it. If we move it, if we're bouncing on a mini trampoline, if we're walking, running, we can stand at the grocery store and just bounce even. And all of this helps. What we want them to do is to jiggle. Because if I take that sponge that's full of honey or full of syrup and pour a bunch of water in it, it's going to rinse out eventually. But if I just sit there and hold it like this, it's going to stay in there. And then it's going to dry. And then it's going to mold. And then it's going to turn to something we don't want, which we all know what that is. So our goal is to take our sponge, which is our whole body, and especially our breast, once again, super hydrate and manipulate the breast tissue. Does that make sense to everybody? It's really so very basic that it's almost so simple that it's like, why am I even talking about it? But if you understand just how our body is made, and this is just the breast tissue that I'm talking about. So all of our muscles and all of our body is a sponge, and the whole system, this whole lymphatic system happens throughout. So it's critical that we have plenty of water. Now I know the older we get, the more we drink, the more we go to the bathroom, right guys? Yeah. But guess what? It's good exercise to get up and go to the bathroom. All right, do it safely and get to the bathroom and keep drinking your water, okay? Half of your body weight in ounces. I dare say probably most of us don't do that, okay? Maybe not, but hopefully you do, okay? So what I usually do is I'll take this container, and I drink about 3 of these a day, okay? And I always have one at night, during the night. So yes, I go to the bathroom a couple times at night, but at least I know what my volume is here. And so I know I need 3 of these to get through my day because of my weight, okay? So that's a good way to do it. Or I put a big container and I have to have that water gone for the day. All right, let's see what we got next. Oh, we love this, don't we? Don't we just love this? All right, mammograms are not pleasant. If you have implants, you should not have a mammogram because it can compromise them, okay? So there may be some out there with implants that we're talking. If you have questions about that, I understand them. So mammogram, which is compression and radiation. And then the other picture is ultrasound. Ultrasound does not have any radiation in it. So an ultrasound is great. Okay, there's nothing wrong with it. Let me see what's next here. Oh, let me go past that. Let me go over here. Okay, all right, I want to show you, let's go over here. Let me go to this. This is density. Let's just go to density. Okay, the first picture, A, is a very fatty breast. The second picture, B, has a little bit of denser tissue in that. C is considered fibroglandular or heterogeneously dense. And then D is the densest, the extremely dense. All right, by law in North Carolina, and almost, not quite all the states yet, but by law in North Carolina, when you have a mammogram, they have to tell you if you're one of the top 2 densities, okay? And the reason why they have to tell you is with the mammogram, they can't see things very well. So when somebody tells me I've got dense breast tissue and you can't see stuff very well, why would I want to go back and do another mammogram? Okay, here's a very, very good example. On the left is a picture of a very fatty breast tissue with a tumor in it. On the right is breast density, a breast that is very dense. How am I supposed to see that tumor in that dense breast tissue? It's very difficult. So what they're doing today is they're doing what they call is the tomosynthesis or the 3D mammography. And that's actually about triple the radiation of a regular. And then what they're asking is for all women to do mammograms, right? Well, 50% of us at our age are dense breasted. 50% of us are dense breasted. So if you've had a mammogram and you've been told you're dense breasted, why am I going back for more mammography? I should go right to the ultrasound. So they can see things in the ultrasound. All right, mammograms are good for for seeing calcifications. I'm not saying don't do mammograms. I'm saying if you have a mammogram, that's great. We just don't want to be doing them as regularly as we are doing them, especially if you have dense breast tissue, because they can't see anything anyway. Okay, so they should send you to an ultrasound is what they should do if you have dense breast tissue. However, in Charlotte, you cannot get an ultrasound unless you've had a mammogram in the last 6 months. All right, you cannot get an ultrasound unless you've had a mammogram in the last 6 months. We do have places where you can go and get an ultrasound through HerScan, which is it's a company out of Florida that comes up to Charlotte regularly, and they do ultrasounds, and their doctors write their prescription, the script, and they send the results to you in 2 weeks. So you can get one outside of the system, outside of the insurance, and it's $250 or so that you can pay for. But in Charlotte, because of the insurance and the way the medical system is set up, you're not allowed one unless you've had a mammogram in the last 6 months, even if you've got dense breast tissue. And that's unfortunate, because what's happening is women, 50% of us who are dense breasted are getting mammogrammed every year. And then if they find something suspicious, they go back and have another mammogram, and then they'll finally do another ultrasound. It's truly too much radiation for our tissue, especially if we're dense breasted. So if you're dense breasted, I want you to think about this. I want you to ask your doctor, why am I coming back for another mammogram if I have dense breast tissue? You tell me you can't see anything. So I want y'all to understand that you have that option. And what you're going to hear is, I hear you, but we are not allowed by insurance we're not allowed to do an ultrasound unless we do a mammogram. So that's where I say, thank you very much. I've got a source where I can go get it done, but I'm not going to have another mammogram because I'm dense breasted and you can't see anything. So why should I have it more radiation when it's difficult? All right, now mammograms are a value. Ultrasounds are a value. Thermography are a value. We'll get to that. Mammograms find calcifications, okay? And they can find like 2 and 3 little baby cells of calcification in a duct. They can. For me, if that comes up, I'm going to manipulate the tissue and break it up and get rid of it. That's my goal, okay? They ask us to do biopsies and do further things sometimes. So mammograms are a value to find calcification, okay? I don't want to let calcifications develop in my breast tissue to begin with. I'd rather do something about that before that happens, okay? Ultrasounds find cyst, bubbly, what I would call sort of cottage cheesy, bubbly type tissue. I've had my hands on probably over 1,000 breasts. So there's every continuum between fatty, a little bit fattier, a little bit firmer, a little bubbly, all the way to really, really dense. Okay, so there's every possible continuum you can find. So back over to here, the last two, which is C and D, which is heterogeneously dense is C, and D is very extremely dense. Those two are the two that they're required to tell you that you have by law. So they should say, you have dense breast tissue, therefore your next thing should be an ultrasound. That's what they should say to us. But they say, you have dense breast tissue, we can't see very well, so let's mammogram you again and give you more radiation. And unfortunately, that's really not what we need to be doing to our breast tissue, okay? All right, let me get back over here. All right, I wanna show you, all right, so we talked about the lymphatic system. All right, we've gone over mammograms. We've talked about ultrasounds. HerScan is the company that comes out of Florida that will do the ultrasound for $250, and then they send you the results. So you can't get an ultrasound without a mammogram, okay? All right. Talked about that. All right, okay. All right, I wanna show you this video. This is a video, remember back here where we had the breast, this picture? All right. Fluid is coming out of the breast tissue. It's going to under the arm, the axilla, the underarm area, and then it's migrating up along that blue vein and then dumping in above the clavicle, right up here. It's coming up here and then dumping into the clavicle and then going into the heart. Okay, so I'm going to show you, we're going to show this picture. I'm going to show you. This lady is going to put her hand under her arm. She's going to come out of her breast tissue, press, come up, and then rinse. And what you're going to find is right here, she has pushed fluid into those lymph nodes that you see right there. Okay, I want to show you that piece. This shows you that with your own hands, we can actually move this fluid. Okay, I'm going to play it.
Pausing. Up, and lift and rinse.
Look under her hand.
Rinse and do it again.
The bubbles.
Out of the nipple, into the underarm, pausing there, up through that area, lifting the hand, and then rinsing.
See the bubbles? See the bubbles there? Those are lymph nodes. You see them right up in this area? Those are lymph nodes. Let me go back to here. Those are lymph nodes right up there under the clavicle. All those little yellow ones that you see running up there. She just pushed fluid out of her breast into those lymphatic tubules, into those lymph nodes, and the lymph nodes blew up, and then the lymph nodes emptied on into the clavicle and into the heart. So she literally took fluid from her breast, put it into the underarm, brought it up, and then it empties. And eventually all those little lymph nodes will empty out automatically, all the way one directional. All right, I'm gonna play it again. This is so impressive.
Pausing. Up, and lift and rinse. Okay.
Right there, the lymph
Do it
nodes.
again. Out of the nipple, into the underarm, pausing there, up through that area, lifting the hand, and then rinsing.
Just that easy. We're actually flushing out our sponge. Just that easy. We're actually moving that fluid out. And the more we rinse out this breast tissue, the less toxins we have, the less mutation we have a possibility. Does that make sense? It's starting to make sense, hopefully. I mean, this is just an amazing video, and not everybody's going to feel their lymph nodes, and not everybody's going to see this. She's just a thin lady, and her nodes were just beautiful. Okay, so let me go back over here. All right, so let me show you this. Now, Gay's going to do a full presentation on this. She's going to give you befores and afters. This is a picture of a thermogram. A thermogram is a heat imaging of the breast tissue. All right, we all understand, maybe, all right, I don't know, I'm sure you remember when we had the Boston bomber, and the two brothers, the youngest brother, the one that was left, was found under a boat cover. He was hiding under a boat cover in a boat, and they saw him with a helicopter with a thermal camera. So he was curled up because he was injured under a boat cover in the back of a boat. And they could see this body curled up under the boat cover. So what they saw was his heat under the boat cover, the body heat. That's what they saw. So with that thermal camera, they saw a full body curled up. So they could tell that he was there and that he was moving. Same thing with night vision in the Army. When you see a man walking through the desert, they see his warm body against the cool background. So that's thermal imaging has been around since '82, same year that mammograms came in. However, back in '82, we didn't have sophisticated computers, and we didn't have sophisticated cameras. So today, with Gay's camera, she can measure to the 10th of a degree. So this is a particular person who had, I believe she had Epstein-Barr virus, and they got the Epstein-Barr virus cleared. So she moved from a very unhealthy set of breast tissue to a much healthier. And on the one on the right, you can see how symmetrical things are, how the colors look equal, okay? That's a much healthier set of breast tissue than the one on the left. But I believe this was somebody that had Epstein-Barr. But Gay's going to go through this whole thing with you in a couple weeks. It's an amazing process that can tell you, like the one on the left, you're getting in trouble. You're getting in trouble. See all the little red spots in there? The red spot under the breast tissue is normal. The red at the under the arm is normal, and the red at the neck is normal. But the red in that global or that breast tissue, that's the sternum. That's okay too. But those 3 or 4 little dots on that right breast, those are not healthy. Okay, that shows heat developing, which is toxins developing and mutating and mutating and mutating to where it may progress to something we don't want. So when they come to me and I see this, then I can help them identify those areas, and they might even be able to feel them. And then when they keep working and keep working, then they can get them broken up and dissipated, just like you would dried cheese in the sponge. If I did, if I had a pizza last night and left the cheese in it when I washed in the morning, I would have to get that dried cheese out of that sponge. And the way to do that is hydrate, and then manipulate that tissue. Okay, is this making sense, guys?
Yeah, this is great.
It really is an amazing way to prevent our breast tissue from developing into what we don't want. Okay, and once again, here's the picture of that. All right, density. You can't see the tumor in a dense breast tissue. This is a picture of implants. If you know of anybody that's got implants, and there was a seminar this weekend, a 3-day seminar on implant illness. Illnesses associated, breast implants, illnesses associated with breast implants, I'll put it that way. And there was three full days of lectures. So it's really becoming much more obvious and prevalent. Anytime we put a foreign object in our body, whether it's a new knee, a new hip, an implant in the eye, an implant in the breast tissue, an implant in the mouth, it's all foreign objects. Everybody does not respond the same though to these individual items, but anything that we put extra into our body can cause an immune response as a foreign object. Okay. All right, questions. It's time for questions or comments.
I was delighted to see the man on the program because I had a high school classmate, a male, who died of breast cancer.
1 out of 100. 1 out of 100. So yes, and all men have girlfriends and friends and women that they know. So we lecture to everybody here. But yes, it's very, very uncommon, but it does happen. But with us, it's 1 in 8, and this is serious. This is serious. So has anybody had, I'm sure somebody has been through this process has been diagnosed. If you have been diagnosed and you've treated, there are actions that we can do. We have to change what we've been doing. Otherwise, we're going to go back to the same situation again. So even after diagnosis and treatment, we have to start treating and understanding what's in our breast tissue. We have to understand so we can change what's going on. Questions, comments?
I do have a question.
Yes, ma'am.
If there is something suspicious in your mammogram and you have to go back to get, was it a digital? Why don't they do the digital to begin with?
Well, actually, that's what they're starting to consider, the digital, the standard now. You may end up getting the digital right off the bat now. So, which is fine as long as we're not doing digital over and over and over again. Yeah, it's just the radiation radiation causes cancer. So too many. And if you have dense breast tissue, we should be doing an ultrasound. So, but yeah, the digital is the new sort of standard. They're not all of them aren't doing them right off the bat, but let's put it this way. You go in, you have a regular mammogram, they see something, you go back, you have a digital, which is even more radiation. And if you're dense breasted, they still can't see much. So we should be going to an ultrasound. It just doesn't make sense to be mammogramming 50% of us when 50% of us are dense breasted or of the top 2 densities. Mm-hmm. It just doesn't make any sense. And literally you practically have to give them your firstborn to get them not to do it.
Alicia, you had a question. Go ahead, Alicia.
That's my question. I've been told I do have dense breast, and so they do the 3D and I have to pay extra to have that done. but we do that. But then my question is though, if they do know that they're dent, should I just, and my insurance isn't great anyway, so should I just, if I do the if I ask my physician, like when I see my OBGYN in December and say, hey, can I skip the mammogram and can we just go straight to the ultrasound? Is there any reason, am I going to lose anything by not having the mammogram? I guess is my question. If you go straight to the ultrasound, are you
Okay.
gonna be
First of
losing?
all, you're not going to be allowed to because of insurance. Okay, that's first of all. Okay, second of all,
But what I'm saying is if I pay for, because our insurance isn't that great, I don't get, a lot of things I don't get great coverage for.
right.
So
All right.
if,
What's so beautiful is we all have choices we can make. So what we want y'all to do is to have educated choices. We want y'all to know what your choices are. Okay, so if you've had a mammogram and they found something, right? What's the question is?
well, what I'm saying, in the past, if I had the mammogram and then okay, maybe I didn't.
You want to go to an ultrasound? May I
Yeah.
have an ultrasound?
I mean, that was fine. So now going forward, I do the 3D mammogram right off the bat. But what I'm asking is, if I'm going to be paying for this extra anyway,
Why not?
does it make sense for me just to ask my doctor, can I go straight to doing ultrasounds, not do mammograms?
That's
And
what more of us need to request. We need to ask that and say, I'm not going to have another mammogram. You can't see anything. You tell me you can't see anything. So why do I have to do it? And they'll say, because of insurance.
okay, but then if I tell them, well, I'm going to be paying for it anyway, then maybe
You can go have one through her scan.
I'm missing out by, if I don't have the mammogram. I think that, my understanding is the ultrasound is going to show you everything plus more, but is there anything the mammogram would show that an ultrasound would not? That's my question.
Mammograms show calcifications. Ultrasounds show cysts. And
Okay, that's what I have is cysts.
what's floating in the cyst? Is it firm? Is it echoic? Is it bouncing off the the radar? How firm is it? But cysts can be emptied if you're with the right type of massage. You can empty these cysts out.
Okay.
We see them. Golf ball size cyst, and in 2 weeks we had it emptied, and they wanted to do a biopsy.
Oh, wow. And that was from the massage?
Yes, from
Oh,
the
it
from the massage that we teach women how to do. Yeah. So
Okay.
if anything, guys, if you just take your hand across the clavicle, if I empty here, just with a nice gentle touch right on that clavicle, everything from here has to come up and everything from my breast has to go over. So literally just even doing this when I'm
Okay.
around can be very helpful. Plus it helps everything from the head drain down for sinuses. So just gently
That's
right
good.
right along this clavicle. And then what I do is when I'm in the car, I'm just going to take a flat hand. Now you saw what the lady did. So a flat hand, I'm just going to press up towards mid clavicle. I'm going to do that. And then if appropriate, I'm going to do this, okay, in the right places, okay, so that I can at least move this tissue, press, and then empty. So
Okay.
this, and just move it. If we did this, we wouldn't have 1 in 8. If we did just that little.
Thank you.
You're welcome. Anybody else? I have up on my thing, stress, steps for breast health. Reduce stress. Oh my gosh. It's not as if we haven't had stress this year. So we know that we can be doing everything right, but if we don't control and manage our stress better, guys, we can really get ourselves in trouble. We need to improve our immune system. The best way to improve your immune system is vitamin D. Everybody should know what their vitamin D levels are. All right. They're going to tell you 30 to 50 is normal. I don't want to be US normal. I mean, US normal is not healthy. Okay. We see that. So the thoughts around vitamin D, it can go up 70 to 90. I mean, it can be up there pretty high. All right. And you can't get that with 5,000 IUs of D. You just can't get that up there. So everybody should have you should be constantly monitoring your D. Your D is your immune system. The healthier the healthier the D, the healthier your immune system. So that's really important. You need to know what your tissue feels like. You need to examine it. You need to examine it in the shower. You need to examine it laying down, because everything changes when you lay down. So you need to know what's in the tissue, and we show you how to do that and make sure you understand, so that if you have a congested area somewhere like this, if it happens to get firmer or changes in any way, guess what? You're going to know it, not wait for a year for somebody else to do an exam for you. And as a matter of fact, they're not even going to do an exam for you, in a breast exam in the doctor's office, unless you ask for it. That's the new trend. They won't even offer to do it unless you ask them to do it to you.
Effie, quick question. You mentioned differential in size. Is that just, I feel like a lot of women have different size breasts, and that's only if you see a specific change,
Yeah,
right?
right, correct. So when I'm developing, if I had one that's inverted and one that's not, that's my normal, okay? That would be my normal, okay? If I had one side that's larger, a little bit larger than the other, and I've known that all my whole life, that's my normal. You know, that's my normal. But if one starts expanding more or one starts shrinking some, that's a change. So we have a whole list of changes that we help women monitor. If all of a sudden I woke up in the morning and found a bruise and I knew I didn't hit it, I would really be concerned, because that's a good sign for triple negative. And triple negative is a very fast growing, there's a couple. Triple negative, it's like a bruise or heat, where it came out of nowhere. But that is something, and I'm talking do something and do something now. And that doesn't mean you wait, you get in there immediately. So a bruise out of nowhere is very important, okay, and heat. The other one is a rash that won't go away, and that's generally in the younger generation, younger women. It's called inflammatory breast disease. Very fast growing. It's a rash, a really red rash. It looks sort of like the mastitis, if you ever had mastitis and got all red. So those are the two that are really fast growing cancers. I hate to even mention them. I just don't even like using that word. So those are the two that we really make sure women are aware of. So if you hear somebody say, wow, I broke up and I have this bruise, at least we can say, I've heard something about that. But those are two very fast growing, and they're serious, very serious. Everything else, pretty much 8 to 10 years of mutation, of toxins sitting here and mutating into something before it ever shows up on a mammogram. 8 to 10 years. Girls and guys, we have the opportunity to do something about it. We just need to just touch our breast tissue. We need to engage our partner to really, our guys are better at touching our breast tissue than we are. They know better. When I educate husbands and wives that come in, and the men have better touching or palpation skills than the women do, because they've had their hands on them more than the women have, okay? So we educate the men also on how to help take care of the breast tissue. These breasts are yours. They are your responsibility. They can help, but they are great. So we really love engaging both husbands and wives and partners, everything. We just help everybody to understand, and it's fun, it's easy, and it's, what happens is people come back to us and they go, gosh, I really do like these girls now. I really do. They're really part of me. So that's what we want. We want you to become aware. We want you to love yourself. We want you to incorporate these breast tissue and appreciate them, just like we do when we look at our face. We take care of that, but we're not taking care of our breast. And we have to, because we have to stop this 1 in 8. We have to.
Excuse me, I have a question.
Yes, sir.
First of all, I appreciate the endorsement on the male side being better than the touching thing. That was,
Oh, you
that was
are.
kind of
You
nice.
are.
Unfortunately, my wife wasn't in here to hear that. But either way, I took a lot of great notes. I have to tell you, I sit in a lot of these things, and I've got a whole page of great notes from what you did here today. This was just terrific.
Well, if anybody has another group that they want us to speak to, we speak to everybody. We did 44 of these one year.
Oh my goodness.
Go ahead, sir. I'm sorry.
Yeah, well, I had a question about, I wanted to talk just for a minute about the insurance, because you referenced this several times in the way the system works with the mammogram, and you can't get the ultrasound until you get the mammogram and so forth. So I'm just going to mention that, I get a physical every year, and I went into my doctor, and because of a heart situation that I was afraid of, I finally just looked at my doctor and I said, I need you to do me a favor. Take your Novant hat off, be my doctor for a minute. Okay.
Right.
And if money was not an object, what should I do? And what he said to me was, well, I would do this and this, but it's going to cost you this. Now, my point is, he wouldn't have answered the question if I wouldn't have asked it. How much does an ultrasound cost?
$250.
And how much does it cost to treat the average breast cancer patient?
I don't even want to go there.
It's kind of a no-brainer, isn't it?
Yes, sir, it is. It's absolutely a no-brainer. Touch your breast tissue, understand what's in there.
I've been self-employed for 20 some years. And I'm not going to go into all the insurance thing because I might get irritated. But the fact of the matter is, if you walk into your doctor or a medical service provider and you say, I'm going to be self-pay, you're going to get somewhere between a 40 and 50% discount right out of the bat. Novant gave me a 40% discount just when I walked in and said, I'm going to be self-pay. And when I asked my doctor about that, he said, we wish everybody was self-pay because we don't want to deal with the insurance companies. No kidding. So I think the question is, what is your health worth? And, do you have the ability to weigh both sides of that? And what do you get and what does it cost you?
Right.
And-
Well, the problem is women don't know we have other options. They don't know that they can actually manipulate their breast tissue. They don't know how to do that. So that's what this is all about. Educate that you have options. You have an option to tell a doctor, no, thank you. I'm not doing the mammogram. I'm going to go to somebody else, learn how to touch my breast tissue, and I'm going to monitor them so that I know what's going on, not you. It's my breast.
For sure.
It's my body.
Effie, so I realize it's annual mammograms for recommendation. What would you say, in your opinion? And I know everybody's different to a certain extent, and I don't want to.
All right. A mammogram.
Like how many? What is a safe amount? I mean, do you ever do a mammogram or never?
I will never have another one. No. A mammogram every once in a while is okay. And
What do you call once in a while, just to be clear?
get a base mammogram. Get a base mammogram. Find out if you're dense breasted. That's great. Okay. And once I find out if I'm of the two top densities, I'm not having another one.
Okay.
I may have one every 5 years. I'm not going to, but I may. That would be something I might consider. And then if something starts developing, then we readjust. Okay. We do the ultrasounds and stuff, but we readjust if something starts developing. But I don't even want to go to there because I'm going to prevent it before it ever happens. That's my goal. But if something does develop, then we talk about what your options are. And then we educate you. If you decide to have another mammogram, expect this, 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 and this. And in less than 2 weeks, you could have a biopsy because that's how hard they push. So you've got to know when you go in there, I'll have a mammogram, but I'm not doing anything else right now, because I've got all kinds of time to think about it. I mean, I've got a lot of years to think about something. If they found something on my mammogram, I can go in there and work it. I can actually do something about it. We don't have to go have a biopsy and a biopsy and all this scarring. We don't have to do all that. We can go get a thermogram, find out what it's like. The thermogram cannot tell you have cancer. It is simply a risk assessment saying you're in danger. Let's do something about it. And then we start working the tissue, and then we start watching it fall apart. It gets softer and it goes away. Then go back again and have another thermogram to see if the heat is reduced. That's where the thermogram comes in handy. The thermogram tells you you're in trouble.
I've scheduled a thermogram for next week. So
Friday. I thought you were going Friday.
Yeah. Is it tomorrow?
I think it's Friday.
Oh, it might be. Yes, it is. Yes, it is. Thank you for reminding me.
And then I will see that I will see.
In 2 weeks on not this coming weekend, and Steve, I want to let you kind of share what's coming up next week. But in 2 weeks from today, I will have had a thermogram. Hopefully, can share my experience.
Yes.
Because I fall into some of this category of what we've just talked about today, and I'll be able to share my experience. And Gay will be here to talk about more about that. So, Effie, amazing! I'm so excited to have met you and to have heard this, you guys know that I have worked with Thrive Personalized Wellness personally and at the Y for some time, and they practice functional medicine. And for me, there's so much to be said for really looking ahead and looking at things and taking care of yourself before something's diagnosed. And that's kind of what we're talking about here. And
We've got to be preventative. The system is not working.
right.
It's not working.
And well, I'm super glad. Effie, does anybody else, before we move on to, I'd like Steve is here. He's going to be our host for next week. But does anybody have any other questions for Effie before we move on here? All right, awesome, Effie. I am so excited to have connected with you, and this will be up on our YouTube page for anybody to take a look at later or share with friends and family. So that's amazing. And I'm so excited to have our next week's host here. Steve, you want to give us a little introduction of what we're going to have next week?
Sure. My name's Steve Schick. My wife and I own a business called Chefs for Seniors. We're actually in the senior nutrition business. What we found is that statistically, 50% of the seniors that show up in an emergency room are actually malnutrition. So, we hooked up with a gentleman from Wisconsin who started this business several years ago and really started to teach us how to provide better nutrition for people right in their homes. So there's teaching involved. Next week, we're going to be talking about nutrition tips, 10 nutrition tips to help you live a healthier, better life, to go along with some of the things that Effie talked about and so forth. And we're kind of on the same path. We just do it in a little bit different way. My wife and I believe very strongly that food is medicine. And we're going to talk about what that medicine looks like next week.
Well, I am so excited about this. It's been a great program. I'm so happy you guys joined us today. Effie, once again, thank you so much.
My pleasure.
Great
what
job,
you're doing
Effie.
is
Thank you.
amazing, and I'm so glad you're getting this information out, and I hope that I can get it out to more people. So we appreciate you being here. It's good to see everybody today, and I hope to see you next week and the
Thanks,
following week for more about what's going on with the thermogram. So
Thank
thanks.
you. Thank you very much.
All right. Bye, guys.